I see a few people coming in. Thanks so much. We're going to get started in just a few seconds. We're aware that we're just a minute or two over, but we should get started soon. Thanks so much for joining. All right. So just mindful of the time. Sarah, if you don't mind, I might just jump in, and then as people sort of trickle in, I will keep an eye on that. Yeah, so let's get started. So everyone, again, thank you so much for joining today. My name is Hannah Holmes, pronouns she and her. I'm the project coordinator at PLEAC, the Public Legal Education Association of Canada. In the spirit of reconciliation, I acknowledge that I am located here in Toronto, Ontario, on the traditional territories of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We are very, very excited to hear from today's speakers, Sarah McHugh-Wade joining us from the Journey Project to speak on today's webinar titled A Learning Journey, Successes and Lessons from Building a Legal Support Service from the Ground Up. I'm sure we're very excited to dive in. Just a few quick administrative notes before I have Sarah start off today's presentation. So the webinar is being recorded. We will be uploading it to the YouTube channel. The link will be circulated afterwards for those who want to rewatch, for those who weren't able to watch live. There's also going to be a brief survey at the end of the webinar, so just take a minute or two to complete it when you can. And then finally, please feel free to use the Q&A button or the chat function to sort of ask any questions you might have throughout the webinar. In the meantime, I'll keep an eye on those so Sarah can address them at the end of the presentation. Hopefully I didn't talk too fast, just trying to maximize Sarah's time. Without further ado, I'll pass it over to you, Sarah. Thanks so much.
Thank you so much, Hannah. I'm going to go ahead and start by sharing my screen. And so if folks could, I may not see any of you once I do so. So if Hannah can just chime in, letting me know when you can see the slides, that would be great.
Looks good, Sarah.
Okay, fantastic. Okay, so I wanted to start by thanking you all so much for making the time to tune in today. I know it's a super busy time of year for many of us. And I also wanted to note my appreciation for your understanding and flexibility for having to reschedule this a couple of weeks back at the very last minute. My name, as Hannah said, is Sarah, and I'm one of the legal support navigators with the Journey Project here in Newfoundland and Labrador. I was the very first LSN back in 2017 when the project was born. So I've really been able to see all of the amazing growth that we've had, as well as some of the challenges that we've had along the way. I've really had a front row seat to all of that, and I'm happy to share that with everyone here today. I'd like to begin by respectfully acknowledging the island of Newfoundland as the ancestral homelands of the Mi'kmaq and the Beothuk. We respectfully recognize the Inuit of Nunatsiavut and Nunatuhavut, as well as the Innu of Natassinan and their ancestors as the original peoples of Labrador. We acknowledge that this land on which we learn, grow, and live was taken without permission and without consent. Sexualized violence is disproportionately perpetrated against Indigenous peoples, especially Indigenous women, girls, and Two-Spirit people, and continues to be used as a tool of colonialism today. My plan today is to take you through what the Journey Project is, how it was born, how it's evolved, and what it looks like, as well as what we hope for the future. I'm going to give an idea of what our project looks like in terms of client demographics and regional reach. I want to share some of the biggest lessons that we've learned along the way and how that's impacted the way that we deliver the service. And of course, at the end, I do want to leave room for questions, comments, thoughts, anything at all that you would like to share. So first off, I'm going to start by diving into what the Journey Project is, where it came from, and sort of where it's been for the past 6 years. So I know that some of you may be familiar with what the Journey Project is, but I'm going to give a quick overview. It was born as a partnership between the Public Legal Information Association of Newfoundland and Labrador, or PLEAN, which is our provincial plea group, as well as End Sexual Violence NL, which at the time was known as the Sexual Assault Crisis and Prevention Center. PLEAC and the center had, for years been informal partners working together to co-facilitate healthy relationships presentations across the province, creating resources, referring clients to each other, sitting on committees together, really, often sharing a lot of the same spaces. And so as the two organizations worked together more and more, it became really abundantly clear that there was a big gap for survivors in this province who did want to access legal systems, and the difficulty that they were having in navigating those systems. And then the second piece that was really obvious was that the support that is there for survivors really needs to be more wraparound. The piecemeal approach has not been working. So that's sort of led us to why Journey was born, where it came from, and led to the mandate that we have today, which is to support individuals who have experienced sexual violence or intimate partner violence in navigating their unique experience with any legal system. So I do like to make a note, I guess, on the terms sexual violence and intimate partner violence and what that means to us. To us, we really believe that each survivor interprets sexual violence and intimate partner violence differently based on, their own personal and unique experiences and their lived experience. And so this program then is open to any individual who has experienced what they consider to be sexual violence or intimate partner violence. Our support is not limited to those who have experienced criminal offenses, for example. Effectively, a person calls us, we explain the eligibility to those who reach out to us, and then they as an individual will determine if they qualify. And that's good enough for us for meeting our criteria. Of course, have definitions for policy purposes, but they are not in any way meant to define who qualifies for our services. The survivor really determines if their experience was sexual violence or intimate partner violence, and they determine if they're a good fit. So as I mentioned, the project launched in 2017. At that time, in those early days, it was focused really solely on providing trauma-informed training to legal stakeholders. During that first year, it became increasingly apparent from all of the folks that we worked with in terms of our community partners that there needs to be one-on-one support for survivors. The information piece to service providers is great, but there needs to be direct support for survivors. And so that's really where the Sexual Violence Legal Support Service was born. So in that summer of 2018, we launched what we now call Journey Project Legal Support Service, because we've expanded beyond sexual violence. And so this particular service, the Legal Support Service, is what I'm really going to be speaking to today. In the summer of 2019, then, we launched our third-party reporting program, which is a partnership we have with the RNC, the Royal Newfoundland Constabulary here in St. John's, which allows two of us, myself and Janet, to take anonymous statements from survivors who wish to identify their abuser and, disclose and document what happened to them without triggering a criminal investigation at the time. Then in the fall of 2022, so just last year, though it feels like we've been working with these folks forever, we opened our 2 satellite offices in addition to our main St. John's office. So the satellite offices are in Corner Brook, which for those unfamiliar is on the western portion of the island of Newfoundland. And then we have our Labrador office, which is in Happy Valley Goose Bay, which is really sort of the central hub, I guess, of Labrador, right there in central Labrador. And then earlier this year, we expanded in a very major way by removing our minimum age requirement, allowing us now to serve folks of any age, and expanding support to those who have experienced any form of intimate partner violence, in addition to continuing to support people who have experienced sexual violence. There are a number of other resources and services that we're so proud of, but like I said, I'm focusing on the legal support service today. But I will encourage any of you that would like more information on any of our other services, like our training, our survivor guides, our outreach, our third-party reporting, please do reach out to me. We're really happy to share these any resources or expertise that we can that might be helpful. We are big believers here at not reinventing the wheel. So anytime we can help, our friends and our counterparts across the country, we certainly like to do that. We're really big fans of RND, which for us means rip off and duplicate, which in fact I ripped off from our friends at SVNB. So anytime there's room for R&D, strongly encourage that. So what is the Journey Project Legal Support Service? This is really this is the biggest, certainly the most utilized piece of the Journey Project. When clients are reaching out to us, it's largely to access the support of us, legal support navigators, and to avail of the legal support service. When a person reaches out, it involves, connecting with one of us legal support navigators, and we're going to then be that person's main, LSN for the duration of their relationship with the Journey Project. We really purposely aim to have people connected with one person only, to right from the get-go, to establish that relationship and to build trust and to ensure that a person has continuity with us without having to tell their story multiple times. Then what we, as LSNs do is we're there to provide a person with legal information, support, and accompaniment to navigating various legal systems, referrals to other supports in the community, a lot of emotional support. And then we also, of course, provide clients with a voucher to meet with a lawyer completely free of charge for them for at least 4 hours of legal advice. Under the new service expansion, we're available to people of any age and gender who've experienced sexual violence and or intimate partner violence. Available to anybody who currently either lives in this province or has a connection to this province. And what we mean by that really is that you can live elsewhere, but your experience of sexual violence or intimate partner violence happened in the province. And when we say live here, we mean just you're currently here. And so, we have many students, for example, or newcomers, or people visiting who are here at this moment and would like support here, but maybe their experience didn't happen here. And so really it's about a connection to the province. You live here currently or you live elsewhere but experience something here. And we're pretty purposely very broad with that definition. And then, because it is a legal support service, it's about, people who are looking to explore their legal options. People don't need to have already started any legal process in order to avail of our services. My colleague Janet sometimes describes it as thinking about your legal options. And so folks just sort of wondering what options are available to me. That's, that qualifies them certainly for the service. In terms of, I guess, what the process looks like once a client connects with us, we have really aimed to keep it as simple as we possibly can and as comfortable as we can, recognizing that just reaching out for help is so hard. And so any way that we can make the process feel less intimidating, of course, we're going to do that. Clients can self-refer to us, and most do, or they can be referred by another service provider. I would say in terms of service providers connecting clients with us most regularly, it would be victim services, women's centers, shelters, and police are probably our biggest sources of referrals. And so then that person, on their own or with another support can contact us in whichever way feels comfortable for them. We try to be accessible in lots of ways. So of course, phone and email, but one small thing that we've done is all 7 of us LSNs have cell phones, so people can text us. We make ourselves available via Facebook Messenger. People can come in and meet with us in person, or we can go and meet with them at Tim's in person or whatnot. So it's really however the person wants to connect with us is fine by us. Once that happens, we have, it's effectively our intake conversation, but it's really just a chat. Asking the survivor really, what is it that you need? What support are you looking for? What's your goal here? And that could be anything from emotional support to just learning more about what services are available generally in their area, being connected with other resources, or to access legal support. And for those who do wish to access legal support, like I said, we do have an intake form, but it's something that we purposely leave largely optional. Like, we need some information from a person to make sure that we're connecting them to the appropriate services, but really most of the intake form is about that. We don't even require disclosure. Really, a person is identifying that they qualify for the service. They don't need to tell us what they experienced or what that involved. We trust that they qualify if they say that they do. And so we don't ask for identification. If people don't want to use their full name or their real name, that's fine. When it's a person that's obviously a minor, we do need to, there's some extra steps there that need to be taken with regards to making sure there's a non-offending parent or other safe adult involved. But for the most part, it's very much, you tell us what feels important or what feels like you can tell us, and anything else is optional. But we do explain that the reason we're asking this is not to just be curious or not to make you tell your story. It's really to make sure that we're supporting you as best we can and that we're referring you appropriately. With regards to the team, I did just mention that there's 7 of us. There's 7 legal support navigators across our 3 offices. We also have an oversight committee, which includes the executive directors of both founding organizations, which are really there to provide sort of, big picture oversight. They're not really involved much with the day-to-day operation of the program. It's really, high level, big picture stuff. Myself and Janet. So I was the first LSN. Janet was the second, who came on in 2018. And we're both still with the project, of course. We were both really involved in developing what our roles looked like. And that's been, I think, hugely important in allowing us to share the workload in a way that leans into our individual strengths and, while challenging us to continue to learn, of course. But I think that approach has really allowed us to center like our needs and our wellness by, varying the amount of client work we're doing from week to week, for example. And especially as the team grows and the client load has grown quite significantly, having that ability to, have our weeks look different has been really important, I think, to ensure that we are taking care of ourselves and that we're remaining well while doing this really heavy work. Over time, as the project and our client base grew, it became obvious that there, needed to be a team coordinator. We're growing. There's 7 of us. And it sort of became obvious, like I said, that there needed to be someone to wrangle the cats, as we say, and to handle some of the bigger picture issues like liaising with funders and external consultants, implementing and overseeing formal debriefing and making sure that's happening, making sure that the workloads are manageable. This person really is a key player in maintaining the health of the team and the project. And so Janet has stepped into that lead and has done into that lead, team coordinator role, and has done so beautifully. And we're so grateful to have her. Then we've also assigned other leads, I guess, based on the specific subset of support. So I am the sexual harassment in the workplace lead. There's an IPV, intimate partner violence lead. There's a children and youth lead, and then there's an adult sexual violence lead. And the reason that we've done that is not to say that I only take sexual harassment clients, for example, or that Ashley only takes adult sexual violence clients. It's not that. We all take, all the clients, we're trained and prepared to do so, but the leads are in place really to make sure that we're developing resources and training in line with our lead area, and to make sure that we're keeping on top of any developments, any resources, any changes in policy or legislation that might be important for us to know about, making sure that we're staying up on PD and keeping the team informed of sort of what they might need to know. And that's been important because, with a heavy client load, I think a lot of those other pieces can fall to the wayside if it's not really clear who is responsible for them. So we thought it was important to make it really clear who who on the team is responsible for making sure that everybody's up to date on intimate partner violence resources and training and legislative changes. And so by really formally putting that in the job description role, we've made sure that those things didn't fall by the wayside. And then, of course, in addition to the LSNs and the oversight committee, there's lots of other people that make the project work as well as it does. We have our evaluation team, we have a clinical supervisor, we have all of our amazing community partners across the province, our team of lawyers, of course, that we refer folks to, and then the core staff at the two parent organizations also play a really big supporting role, I guess. And then, in terms of how we manage the team and what that looks like, we meet weekly for our check-ins, where we can also debrief client, I guess, challenges where needed. And then we also have a monthly session with our clinical supervisor where one LSN is the focus. And so they've had a couple of meetings with this person to work through any particular challenges and come back then to the team to present those and to say, here's what is hard for me right now, and here's what I need from you as a team. And this model has worked really beautifully. And we call it Friday Cry Day because they always happen on Fridays, and there's always a lot of tears. Happy tears usually, but you're digging deep sometimes for some of these check-ins. I did want to speak for a sec about our LSN operations manual. This is our it's our go-to. This is our guiding document. It's 144 pages and growing. What started as our simple sort of service delivery model, 3 or 4 page document in 2018, quickly grew into dozens and dozens and dozens of individual documents to ensure that we were, anticipating every scenario, every client need, anything that might pop up. Do we have a policy to cover this? Do we have a guideline to cover this? Do we have a practice in place to cover this? And so we wanted to, to capture everything that we could think of and make sure that we were offering all clients the same amount of, one intentional, thorough support. And so, as you can imagine, that was a bit of a nightmare to have just all of these things floating around. And so about a year and a half ago, I took all of those documents that had ever been created for TJP, compiled it into one massive document, and really heavily edited that to ensure that everything was consistent, everything in there was necessary, and that everything was still relevant to our day-to-day practices and the way that we had sort of evolved and grown to meet client needs. Spent a lot of time ensuring that, not just the language, but also the processes that we've set out make sense, and that, everything is still coming back. Every service we offer is still coming back to our core values of being client-centered and trauma-informed. We developed them, I think with a lot of thought and a lot of care over the years. And as we did grow our team and establish satellite offices, it was really important that we did have this really sort of central guiding piece to ensure that every LSN is, reading from the same book, literally, I guess, and that every client was getting the same treatment regardless of where they were located in the province or, what other resources they had access to, knowing that if you came to Journey, you're going to get a consistent support, whoever it is on the team you connect with. So there are 2 important notes, I think, about this document. One is that this manual is full of case-by-case caveats. Of course, yes, we want to have guidelines and policies in place for, pretty much anything we could imagine, any scenario we can think of encountering. But we know, of course, that there's going to be situations that we haven't thought of or that we haven't allowed for. And we want to have that flexibility to meet clients where they are and to ensure that we can still make the decisions we need to and change our practices when we need to ensure that, the needs of an individual client are being met in the best way possible. In that same vein, this document is absolutely a living document that is regularly evolving to match the way that our service regularly evolves. And so it's sort of become my baby, I guess, the operations manual. Quarterly I edit this, and everybody has the opportunity to contribute to improvements, I guess, that can be made to this document. And so I think having that one key piece that guides every part of the work has really helped smooth the transition from, two LSNs to a really, a large team. We're about to have 8 LSNs in a couple of weeks, and 3 regional offices. We also cannot stress enough the importance of engaging really specific expertise around evaluation. We did, we were fortunate enough, I guess, early on to have carved out an evaluation budget that was appropriate for us to make sure that we got a fulsome, really detailed evaluation of the project right from the get-go. And so early on, the initial evaluator we had created this really detailed evaluation framework to help guide how she was going to collect and analyze the feedback throughout the life of the project. And from there, she was able to take that and regularly report back to us with stats from survivors, from our partners across the province, from us on the team ourselves, from the lawyers. She did that using online surveys, key informant interviews in person. We had, surveys that we would pass out on paper or that people could access with a QR code by going to SurveyMonkey after every training or event that we would host. And so we tried to offer numerous ways for people to participate. But I think the important piece is making sure that the person undertaking evaluation is, really properly prepared to do that, I guess. I think in the past, prior to Journey, we would often try to evaluate our projects in-house, and I'm not sure that ever really gave it the dedicated time and energy and expertise that it needed. And because, this is such an important part of ongoing sustainability planning, it is, I think, so important to really give thought early on to how do we plan to evaluate and who is best suited to do that. I also think there's a real big bonus to the fact that Peggy, our initial evaluator, Peggy, was not a staff member of Journey. And so that separation allowed, I think, comfort to clients in knowing that they could provide their feedback honestly and anonymously and could share the good and the bad without feeling like, okay, Sarah's my LSN, but there's something she does that I don't like, and I don't really want her to know that I said that. And so, if there's concern about it getting back to me, that person's going to be less likely to be candid. And so that's been helpful, having that separation. I would like to spend a few minutes sharing some numbers from the project, specifically around, total client numbers and demographics, to help give a bit more context, I guess, to the scope of the work we're doing now. So since 2018, we've supported about 812 clients. I pulled those numbers yesterday. So, it's probably 815 now, for example. We currently have 299 active clients between the 7 of us. And when we say active, we mean, we've spoken in the past few weeks. So once that regular sort of chatting with a client every week or two doesn't happen, then we switch them in our system to inactive to give us a better idea of sort of where everybody's workload is. So when I say active, it's like regular ongoing communication. Many of our clients, about 60% of them, do wish to speak with a lawyer. And for those that do speak with a lawyer, they average about 2 hours of time with that lawyer. Again, that's an average. Some people will spend only 10 minutes, and then we have others who need 8 and 10 hours. But those would sort of be the outliers. We, on the other hand, spend significantly more time with clients. We spend about 559 minutes, which is about 9.5 hours of one-on-one time per client over the span of that relationship with the client. So we do spend a lot of time one-on-one supporting that client. In terms of age range, we have clients in all age ranges that we capture, from the youngest, which is 0 to 3, to the oldest, which is 80 plus. And we do have clients all over the province, country, and indeed the world, currently active. On this page, you're going to see a breakdown of clients by age, the area of law that they come to us for support in, and the types of sexual violence that they reported experiencing. You'll note that we don't have any stats here yet on the types of intimate partner violence or on ages below 18, because that expansion did just happen earlier this year. So the stats there are not quite, not fulsome yet, I guess. So you can see the graph there on the top that most of our clients are in the 19 to 30 and the 31 to 40 age range. Though, as I indicated, we do have clients as young as the 0 to 3 range and as old as the 80 plus range. The area of law on your bottom left, most clients are seeking support in criminal and civil law processes. We are seeing growing numbers of clients needing support in family law, especially in this past year with the expansion to IPV, as well as employment law. And then you'll notice on your bottom right the types of sexual violence that people reached out for support around. Most reported experiencing adult sexual abuse as well as childhood sexual abuse. And so I will just note, I guess, that prior to this year, we were serving only adults, but people, there was no sort of time limit on coming to us for support. So many adults that were coming to us were coming for support related to incidents of sexual abuse that they had experienced years or decades ago. So they are, the two most commonly reported areas are adult and childhood sexual abuse. Other experiences include sexual violence in an intimate partner setting, and then other, which could include things like internet luring and stalking are some of the examples that have been shared with us. I'm showing now two graphs here which represent the spread, I guess, geographically over the life of the project on the left-hand side, and within the past year or so, when we added our regional offices, which you can see on the right-hand side. I think I might have said right-hand side the first time, but I meant the life of the project is represented on the left-hand side, and the past year is represented on the right-hand side. You can see that the distribution has and continues to be largely in the eastern portion of the province, which of course makes sense. 40% of our province's population lives, in or around St. John's, but that still leaves about 300,000 people in rural communities. Many of those communities are lacking services and are very isolated. So seeing increases in the other three regions as a result of the satellite offices is really encouraging. And something that's, I think, really notable for us and maybe not as easy to measure is that in past years, during the key informant interviews that our evaluator carried out, community partners would always comment that TJP is amazing, but we need support on the ground outside of St. John's. Every year, for 5 years straight, that's been the feedback. This year is the first year that nobody made that comment. And so we know that slowly but surely this is making a difference, having LSNs on the ground outside of St. John's. And we know that we're going to continue to see that trend increase because the numbers of calls we're getting from Labrador, for example, now that we have Martina on the ground up there, is such a big increase. So I think next year you're really we'll see a much more fulsome picture of the impact of that. Now, I want to get into to some of the lessons learned and best practices. I'm being mindful of the time, and I know that I have about 10 to 15 minutes left before I clue up to pass the floor over for questions. So I'm gonna not speed through these, but try to be concise so that we do have some room for a chat at the end. The first lesson learned, which we cannot stress enough, is that case-by-case caveats really are your best friend in this sort of work. I think the importance of approaching things on an individual basis wherever possible that's really at the core of what being survivor-centered and trauma-informed means. We are working with individuals, with real people in this job, and every one of their situations and needs are different. Because we, as the Journey Project, and many of you on the line, perhaps, excuse me, are we're positioned in the community, right, in the community sector. we have to embrace that. We have to embrace that freedom and that flexibility that we have that some organizations and some systems just don't or can't have. And we use that to be truly responsive and trauma informed in a way that, really responds individually to clients' needs. Of course, we have to have our policies and our guidelines, but we can and should assess things on case-by-case basis wherever possible to ensure that everybody is getting the support that they need and that they deserve. I think a guiding principle of TJP, whether our oversight committee would agree with this or not, but a guiding principle that the LSNs live by is that rules are made to be bent. And I think, sometimes our policies are made to be bent as well. So for us, that means looking at as many situations as you can in this way. It should be sort of the default, I think, rather than the exception to look at things on a case-by-case basis. Does a person need a specific support that we haven't offered before? Let's look into it. And why don't we offer it? Does a practice that we regularly do, does it have to be done in this way? If something different works better for a client, is there a reason that we can't offer flexibility? And I think often when you step back and take like pride or status quo or any of the other factors out of it, a lot of times there is flexibility where you don't necessarily always consider there to be. I think, Hannah and I were talking about this, the importance of, being flexible is important, but also, especially in this sort of work, I think it can lead to overextending yourself and offering support that maybe you shouldn't or aren't equipped to. And that's not helpful to you, and it's not helpful to the client, and it's not helpful to the program. So it's important, meet people where they are, but not to the detriment of yourself. You have to have those boundaries in place to keep everybody safe, not just you, but also the client. Things are not equal everywhere was a very big lesson for us early on. I think it's not going to be any surprise, I suppose, to any of you who work within the community sector or within systems where there are inequalities, but recognizing, particularly for us here in Newfoundland and Labrador, that we have a geography where there are so many regional variations because of all the rural and isolated and northern communities we have, that simply, we do not have literal, like physical access to services sometimes. And that brings with it so many complications because, the services and resources themselves are one thing, but then there's this ripple effect of systems sort of becoming inherently unequal and just like inherently structured to funnel resources into particular hubs. In larger places, smaller communities tend to be more and more, pushed to the margins. And so whatever the gaps look like in your particular community needs to be accounted for when you plan your project early on. For us, that looks like planning for a lot of travel. There has to be a really healthy travel budget. We have to get to the locations that other supports might not. We cannot just travel to the hubs, right? We can't just travel to, in Labrador, for example, we can't just travel to Happy Valley Goose Bay and Labrador City. We have to get to the North Coast. We have to get to the South Coast. We have to get to the Straits. We have to get to these communities that are fly-in only, to these communities that you can only access by driving 10 hours on a bad highway, because other people are not going there. And so it's important to think about, what does that look like in my community? Do I have a lot of newcomers that I'm supporting? Maybe I need a lot of interpretation supports up front. Maybe I need to make sure that we have money for childcare and transportation. Whatever it looks like, the guidance has to come from your particular community or the people that you're supporting. I think we struggled quite a bit early on with this, with the inconsistencies in service and supports available across our province. Some towns have ample supports, some towns have some, okay supports, and some have none at all. And some mandates just don't exist. And I think until you know the local gaps that exist, it's really hard to figure out, where do I fit in and how do I help close some of these gaps? And the only way to know that is to speak with the people, connect with the people in your community, the people that know what's happening and that live there and work there. So, survivors first and foremost, but also, shelters, youth groups, women's centers, food banks, schools, victim services offices, like who are living in and working in the community you're operating in, that really know where the gaps are and how they best need to be filled. I think the other piece about expectation management is really important, but not just from the perspective of like clients, but also your own, for us, I think that's a lesson we learned, that, if we do manage to find this like community champion in a small rural community, right? Because many communities have them. There's this one person who's the go-to, the be all, end all for everyone in that town. They do everything. Well, how heavily can I actually lean on that person, right? Like, how much can I reasonably ask, from that person? And so I think managing our expectations around how much we expect people to partner is also important. Excuse me. The next lesson is to be open-minded, and I'm aware that this slide sort of presents a lot of platitudes, but we can't stress enough the importance, I think, of being open-minded when you're building something like Journey. Things will look different than you thought they would. They just will. The way that we thought Journey would work and the way Journey actually works is like chalk and cheese. Support does not always look what you think it will look like. Collaboration takes infinitely more time than you think it will. It just does. You will not do it right the first time. Things that you thought might be easy to roll out sometimes aren't, and sometimes the things that you were really expecting to be a pain might be a pleasant surprise. But I think at the end of the day, it's really like, expect the unexpected. Embrace that your mindset and your definitions of success will change as you do this work. And the piece around trust the process is important, but the way we frame that is like, do the work up front to build a really solid process and then trust the process, right? It's not just going to happen. You have to put the work in, but then trust that it will. The survivors you work with will tell you what they need. The communities you work with and the service providers you work with will tell you what they need. But you need to be humble, I guess, in receiving that, and recognize that, okay, we need to change. And that's such an important, that's been a huge part of this project, I think, is recognizing that we will need to pivot and we will need to stray, I guess, from what we initially thought. I think listening to expertise is huge, but also that piece of like asking who is the expert, and hint, it's always the survivor. They're the ones that know what is safe and best for them. They know the dynamic of their life and their relationship and their partner. They know what their own capacity is, and all of those things better than we ever would. So guidance always has to come from the survivor first and foremost. And when you're thinking about putting together supports and putting together a team to support a survivor, the survivor has to be like, they're the primary expert. And so recognizing that when we talk about expertise, we really talk about like going back to the person that we're supporting. I think also recognizing what our limitations are. I don't know if this is true in all sectors, but I think something that can be true in our sector, community sector, is this idea of like turf and ownership, and that, well, this is something I'm working on. And so, our organization owns this. I don't know that we need to bring anyone else in. And I think we need to let that go. If the end goal is to support survivors, we need to sort of check that pride at the door and work toward the ultimate goal, even if we are coming at it from different perspectives or different mandates. At the end of the day, we're all working together to help people heal or find justice, or whatever it is that they need. At the end of the day, we're trying to help survivors. And so who owns a thing is not as important as sort of, I guess, responding to the needs of survivors. I think on that same note, you do need a mix of perspectives. The survivor is so important, but you do need that mix of like frontline workers and top level management. You need the people on the front lines who do the work and know the issues inside and out, and then you need the people at the top who can make decisions and affect change. The piece around, consistency and continuity being vital is, if you want to offer a truly survivor-centered service, you can't just sort of make an initial, you can't have like this initial contact with a person and never go back, or an initial contact with the community and never go back. That's why we talk about the importance of, traveling to all of the places and having regular contact with all, as many communities and as many service providers as we can, because that's how we build relationships and trust. Organizations change, staff change, people living in communities change, needs change. So being on the ground constantly is really the only way that we're going to know, what are the needs, how do we fill them best. And I think that's what we've been doing, and that's why we've become such a trusted organization in the province. We also know that, project-based and short-term funding, like many of us operate on, doesn't create long-term systemic change. We know that, it's hard to create that consistency and continuity when you're operating on the idea that this project will end in 2 years or 3 years or whatever. And so that's where advocacy comes into what we do as well, because that is vital. Advocacy for long-term funding. It's really important to have clear policies and boundaries and governance up front. Be very clear in the beginning, if there are multiple organizations working on a project, what does that look like? Who is responsible for what? It has to be very clear and clearly written in the, memorandum of understanding or information sharing agreement or whatever, contract you enter, to make sure that there's a very obvious, first of all, who's responsible for what, who owns what, who owns things once the materials are produced, if the project ends, all those questions. But also really important to, name one organization or individual who will really be clearly treated as the lead. We really learned early on that there has to be that one person where the buck stops, where final decisions are made, where if there's difficulty reaching an argument, this person, their voice will be the deciding factor. You sort of need that one singular voice to have the ultimate say or sign off on things. Prior to this project, both organizations were very small. And so TJP was an infusion of money and possibility. And sometimes it was a bit hard to keep the train on the tracks for us. And so we did learn some of these lessons early on. But I think it's we know now that, the amount of time and thought that needs to go into figuring out these sorts of policies are, I can't overstate the importance of doing that work early on about the governance piece. With regards to, I guess, where we are today, because of our 7 years of growth and learning and growing pains, we're now at a place, like I said, where we are a really trusted source of support for survivors across this province, and that is incredibly humbling to be there. We're a multifaceted program. We're provincial, truly provincial in scope. We have our 3 offices. We're traveling to every corner of the province, reaching thousands of people every year. We have our clients, but we also have thousands of others who we're reaching through our outreach and our training and our information sessions. Went from this idea of a project that wasn't entirely sure what the mandate was to being a really respected resource in our province. I think our approach to offering client-centered and trauma-informed support is core. It's at the core of everything we do and why we've become that trusted source in the province. Clients come to us because people they trust can vouch for us and say, yeah, they're going to listen to you. Your voices will be heard, your voices will be centered, and you're going to be supported. We pride ourselves on how accessible our project is, and we did a lot of work early on to ensure that. Our definition of accessibility shifted early on from being about, how we always thought about accessibility was making sure that we are thinking about, physical accessibility and mobility and making sure that there's supports in place with regards to hearing and vision, to being about, all of that, but also other measures of accessibility, which I think are often overlooked, which is things like providing transportation and childcare and paying for cultural support. And if a person hasn't eaten in multiple days and can't think straightly, then we'll feed you. And so things like when we say accessibility, we really mean it quite broadly. And it's now, it's not just sort of best practice to ask about accessibility now. It's mandatory when we're reaching out and planning things. And I think, of course, organizationally, our capacity has increased so much because of Journey and the work that Journey does and the many lessons that we've learned. all of this means that survivors in this province are more empowered with information to make, independent, informed decisions about whether and how they wish to move forward on their journey, whatever that looks like. So, clients that did provide feedback last year indicated that, for example, 88% report that they understand their options better. 84% felt better prepared to resolve their legal issue. 95% of clients who participated shared specific examples of directions or steps that they took as a result of connecting with TJP. And that's really, we're really proud of those numbers. There's no other way to say that, I don't think. And so I guess with TJP tomorrow, I was speaking with Janet last night about this, and I said, what's your hope? What do we hope for TJP in the future? And what she said was lovely, I thought, which was that we would love for TJP to not be necessary. We'd love for both, all of us to work ourselves out of a job and to be at a place where TJP support wasn't needed. But until that time, we will consistently and constantly grow to meet the ever evolving needs of survivors who teach us every single day what it means to be trauma informed and resilient. And on that note, I'm going to share my final slide before I stop screen sharing. I wanted to thank you all so much for your attention and your time this afternoon. You'll see my contact info is there, but I can also have Hannah send that out to all of you if you'd like to have my direct info, but it is there on the screen. The number you see, as well as my email address, is my contact info directly, so that we can chat one-on-one if you'd like to chat further. And I'm going to stop screen sharing so that we can all see each other and have Q&A.
Thank you so much, Sarah. That was fantastic and so informative. And exactly, we have a few minutes left for Q&A. I see a question in the Q&A specific sort of section here. So tremendous presentation. Thank you. A thorough outline of the whole project and the lessons, best practices always can be so valuable to others in the field. Didn't catch where you learned of your outside evaluator. And in addition to being very happy with her, did you receive a nice nonprofit rate? Smiley face. Go ahead.
Thank you for that, Joel. I appreciate that. So we have a different evaluator now. Initially, our initial evaluator worked with us until last year. And in terms of where we learned about her, it's just, it was a word of mouth thing, I think. There's not a lot of people doing evaluation in St. John's. And so Peggy came highly recommended by some of our partners in community and government. And she was super familiar with evaluating, government programs and nonprofit programs. I think her rate was pretty fair, but I don't know for sure. But I think certainly, better than some of the larger consulting firms. But then I think we sort of outgrew Peggy's scope, which is lovely, but also was a little bit sad for us because I loved working with Peggy. And so now we have a new team, a team of 2 people doing our evaluation for us. And they're just doing a big sort of blitz at the moment, actually, of interviews with clients. But it's a new team for us. So we're adjusting to that. But our framework remains the same. Yeah, so I guess it was really a word of mouth thing, though, how we connected with our evaluator and just like prior experience with her.
Thank you so much. And any follow-up questions around the evaluator, feel free to chime in. I do actually have another question here. Did you refer to any other operations manuals or templates as an example when building your own? What was the biggest challenge in creating this, and how long did it take you from start to finish?
Yeah, thank you for that question. I think so. No, we didn't refer to anything else. This was entirely like a beast of its own magnitude. We really just, I don't know that we would have been able to take guidance from elsewhere. Maybe we would have, but because we really did want to take like dozens of documents and turn it into one cohesive, singular document. So um, what the process looked like was really it was a lot of sort of pairing things into category, not pairing, but like grouping things into categories and figuring out are we saying anything at all contradictory? Are we saying things in ways that are unclear? So it took a lot of like editing to ensure that all the messaging was consistent, to ensure that we weren't saying one thing in one section and something slightly different in another, because I think that's the challenge when you're creating all the documents separately. And so um, it wasn't. I will say it was a bit of an onerous process, and it took me. I don't know. I'm not really good at tracking hours of things, but I would say it took me probably like a month, not working on it all day every day, but probably a month of dedicating a good amount of time to reviewing all the documents and then putting it into something that made sense. Um, but I do think that it was time well spent because we now have everything living in one place. People are not having to sort of um, wonder, first of all, does this policy even exist, and if so, where is it, and who wrote it, and what's the most recent version? And it was all just a bit of an administrative nightmare, to be honest. And so it was worth the time up front. And now I spend probably one day every quarter making edits.
Awesome. Thank you very much. I think we might have time for one more. So I have another one here. So on the topic of Facebook messages or inquiries, do you get a lot of these
Yes.
inquiries on Facebook on this platform? Do you have multiple eyes on it, or one designated staff? Can you speak to this intake option a little more?
Yeah, sure. And so we don't get a lot of inquiries that way. I would say maybe like 2 or 3 a week. Like it's not a high amount. But it was something that was, early on in the project, when we were sort of doing some focus groups about, what do we need to do to make this work, to make it more accessible to everybody. Um, we were told that Facebook was important, and I know that Facebook is sort of like an old person social media now. It's my favorite social media, but I'm told it's an old person social media. But I will say that in Newfoundland and Labrador in particular, Facebook is like the thing, and in rural communities, like there's no better advertising than on like local community Facebook pages, buy and sell pages, things like that. And so Facebook was important for that reason. So we probably get a few a week. We don't have a designated social media person for any of our social media accounts. And I will say, we just recently in the summer actually had a social media strategy prepared for us. Um, that's something we will all admit that we're not doing well enough. Because we don't have a designated person, I guess, we don't have a lot of time or the time that it deserves. So that's certainly a priority for next year. It's mostly Janet or myself that will, if we see a message, we'll respond to it and try to direct people to our phone or email. So right now it's not a big piece of work managing that, but social media as a whole, we do have some room to grow there for sure.
Awesome. Thank you so much. Just keeping an eye. I mean, I feel if we had more time, there's lots of more questions that we could probably get to. But thank you, Sarah, for providing your contact information. I'll just quickly say to folks, if you didn't catch it or for any reason need to connect with Sarah, and for any reason being obviously very good reasons, any other questions, comments, feedback, I just want to connect or collaborate, please feel free to reach out to me. And I'd be happy to sort of connect you and send you in the right direction. I know we're just 1 minute past and folks need to get to their next meetings and all that. I just want to say a big thank you to Sarah. Thank you so much for your time and the very wonderful and informative presentation today. That was really great. I know it's a busy time. Really appreciate you being here today. And of course, thanks to everybody who joined us live. The recording, again, will be uploaded and circulated. And again, questions, feedback are very welcome. And again, if you want to connect, just feel free to reach out. Have a wonderful rest of your week, everyone, and a lovely weekend. And this is technically our last webinar before, the sort of winter break. And so we will be sort of back in the new year. But it's nice to see everyone.
Thank you so much, and happy holidays to anybody that celebrates.
Thank you
Have a
so
lovely afternoon.
much. Thank you all, everybody. Bye, Sarah.
Bye.